Thank you very much, Mike, for that very kind introduction. It's a pleasure to be here, and it's a pleasure to see that the audience is quite full. Do you hear me? Yeah, great. Yes, let me see, the clicker is here. It's funny that you mentioned already, Mike, that is the clicker doesn't here maybe. That you mentioned already that the World Health Organization suggests green spaces as a means towards better health and healthier cities. Because I wanted to ask you actually, as a starter for this talk, that if you knew that 43,000 lives could be saved each year in Europe if the cities lived up to the WHO recommendations of having at least 1 hectare meter green space within 300 meters from their residence, walkable distance. But the question is, why does the World Health Organization bother about trees? That is something that for me, when I started working in this area, it was a big day in my life actually, that the World Health Organization, I was working together with them then to put up these recommendations and work on an urban green space indicator. Because the reason why the health organization, the biggest health organization in the world, is bothering about trees and vegetation is that patients today, people today, live and suffer from completely different kind of diseases than we used to 100 years ago. People suffer from chronic, non-communicable diseases. They suffer from environmental threats, climate change. They suffer from loneliness, not having a social connection in your life is as dangerous as smoking 15 cigarettes each day. You see, this is a clear health threat. Suicide is a more common reason for death than car accidents or war. It's the most common reason for death among young Europeans today, suicide. There's clearly something we need to do about this. Because cities come with many opportunities. We cannot forget that. And that's also what Mike said, that we have to believe in cities as the opportunities, as a place for solutions. So we cannot only talk about the downsides. They come with job opportunities, education, culture, etc. However, they also come with all those things like pollution, urban heat island, noise, crowding, stress, chronic stress, techno stress, and so on. And what they also come with is a disconnection from nature. You know, as a species, we are evolutionary adapted to living in a green environment. So there are differences between living in a green space, living in the countryside, and living in a city. We know, for example, that depression, schizophrenia, and anxiety disorders are much more common in cities compared to the countryside. And there are also been brain imaging studies showing this, that there are differences in particular areas of the brain that are dealing with that are sensitive, vulnerable to stress, so they fire up more in people that live in cities compared to those on the countryside. And since today more than half of the world's population live in cities, we really need to think about this. What do we do about these health consequences, the harmful health consequences of living in cities? So today more than 50% live in cities, and by 2050 it is expected that around 70% of the population in the world will live in cities. And of course, today most of the global north is already urbanized to a very high extent, but we see now the cities in Africa and Southeast Asia and other parts of the world that are also urbanizing. So we need to me, it's fundamental that we start looking beyond and start preventing that we make the same mistakes in the cities that are growing today as we have done here with for example, integrating more nature in the cities where we build them. Okay, so as Mike already said, I used to work as a physician, as a doctor in a Swedish hospital. I enjoyed it, but it also came with quite some frustration because my patients, I was often left with the feeling that I couldn't really help them. Because as a doctor, you cannot do much about air pollution in the hospital. I couldn't do anything about the regulations. I couldn't do much about that they didn't have a social network. I couldn't do anything about their chronic stress levels. There's no pill for chronic stress. There's no medication for that. There's no medication for disconnection from nature. There's no such thing yet. So after some years of frustration, I realized that I really wanted to take this seriously and further investigate the beneficial impacts on human health of nature. I think many of us working on research on the environmental impacts look at air pollution and noise. There's a lot of evidence on that. But when I started working on this, we were quite a small group looking at the positive sides of nature. And for me, that's been great for my life. I really enjoyed this kind of work. It's been nice to see benefits coming out of something. However, today, now this is some 15 years ago, and during these last 15 years, there has been an escalation, I would say, in the studies and the research that come out on this topic. And we have a lot of evidence. It's clear by now that green spaces are a real public health asset that we need to invest in and preserve. As I said, there are so many studies and so much evidence that has accumulated, so I can only give you very few examples. For example, urban green spaces reduce chronic stress. This is from a study from the US showing that people living in greener areas have lower level of chronic stress, a biomarker for that. We also know that physical activity is promoted in areas, in neighborhoods where there's more green space. So this slide, for example, showed that in comparison to having no green space whatsoever, people living with where it's 80% green, doesn't matter the number really, there is almost 1.2 higher chance of being physically active. And what is important in all this, because even if we say, okay, 1.2, maybe not so much, but physical inactivity is one of the main risk factors for disease and mortality today. It's a strong risk factor for cardiovascular disease and early mortality. Similar to smoking, like smoking 15 cigarettes per day, it will for sure shorten your lifetime, right? And if we can prevent that by having people socializing in green spaces, is also very important. One of my favorite slides is this one. It's from a landmark study published in 2008, so it's already quite old, but it has been replicated many times. I just showed this one because it was the first one, and it has a neat little sample of 40 million people that Mitchell and Popham published in 2008 in The Lancet. And it clearly shows that the inequalities in health that we see related to socioeconomic inequalities are significantly reduced in areas with more green spaces. There seems to be something with the green areas, with nature, that buffer these inequalities that we see otherwise. Because this is a fact. People of higher income will live longer lives than people of lower income. And there's no biological reason for this, of course. This is all about different opportunities in lives and a societal issue. So if we can make that more even and more equal by having more trees, more vegetation, more accessibility for everyone to high quality green spaces, we can reduce these inequalities and have a much more fair and just society. I thought it would be nice to show something local. We did a study during the lockdown here in Catalonia, which was quite severe, as you know. People were really bound to their houses, to their apartments. And this was a sample of around 10,000 people, which we surveyed. And we found that those that did not have any views of green whatsoever from their houses, and that was around 15% of this sample, the risk of developing severe clinical depression was 2.5 times higher compared to those that had views of green. And that was on par of other high risk factors like low income, for example, which was also a risk factor for depression during the COVID. That is, for instance, that is kind of a forgotten outcome of the COVID-19 pandemic. Of course, the mortality related to the pandemic was detrimental, but WHO also has found that there was an increase in around 25% in depression and anxiety disorders during this time period. So again, if we can reduce that risk a little bit with green spaces, there's a lot of health gain. I'm saying these things because maybe you will read papers that say, okay, it's just a small impact of having green spaces, maybe it's just 1 or 2% better. But given the issues we are talking about, we're talking about the main threats to health today, then only small changes have a huge difference on the population scale. This clearly also goes for climate change. That's another major threat to health today. I do prefer talking about positive things, but in order to put things into perspective, right? Climate change is happening. Cities are heating up. Everyone is affected. Tens and thousands of people die every year in Europe because of the urban heat island effect. So this study published by the Barcelona Institute of Global Health, where I also work, showed that by increasing the tree cover in cities to 30% in each neighborhood, we could reduce this extra mortality with 1/3. So 1/3 of those premature deaths related to heat could be prevented by increasing the tree canopy. All of those things should be like incentives for investors and urban planners and decision makers to really take this as seriously as the World Health Organization does. Talking a little bit about the mechanisms behind why do we see all these benefits, apart from the shading and heat reduction, which is a quite clear, straightforward mechanism. A few studies have also shown that children who grow up in the countryside and who play with dirt and in soil that is rich in microorganisms, they have they have measured also their gut microbiome, the bacteria in the guts of these children, and found that the children who are out in nature have a healthier composition of the gut microbiome. I don't know if you're aware, but at the moment there's a big hype around gut microbiome, and you can take pills for that, and you can take lots of these probiotics and prebiotics. But even better is to go out and play in the soil, and especially for our children, of course, right? Because they are the ones developing the immune system, and our immune system, in order to develop, it needs data, and that data is microorganisms that go into our guts. And we honestly, we are not humans. There are like 300 million more bacteria in our bodies compared to human cells. So we are walking bacteria bunches, so to say. 150 years ago, allergies did not exist. So one of the reasons that is speculated why we have so much more allergies today is that we are disconnected from nature and are not exposed to these microorganisms that are so critical for our immune system. Just one example also from the studies that I did in Canada, where I lived a few years, where we also showed that green spaces could reduce the risk of attention deficit hyperactivity disorder, which is also a disease that is increasing today. It could be that it's more diagnosed, but there also seems to be something in the environment that has an impact on children's attention capacity. We found that we found an interaction effect between air pollution and green spaces. So in areas with a lot of green and low levels of air pollution, there was a 50% lower risk of the children to develop ADHD. And this got some attention in media, both in Spain and across the borders. Finally, I wanted to mention also, because most of my work is around green spaces in cities, public spaces that anyone can access and so on. But I'm also co-coordinating a project that's funded by the EU called Resonate, where we're looking at particularly nature-based therapies. Remember I said in the beginning that a doctor does not usually prescribe nature. That's not what we did, at least not back in my days. And this program is looking at how we can actually use nature prescriptions to improve health for people who already have diseases, like a conventional therapy. So that is sort of the mission, to integrate nature in the medical curriculum, in the medical arsenal of treatments and strategies. So what we did, for example, we're doing many things. One of the things is that we made a global mapping, a systematic review of nature-based therapy programs across the world. and looked at what kind of evidence they had for their programs. So the programs that are displayed on this map are also studied in the scientific way. So we can say that, okay, there are many more programs out there. Many of them are probably just as good, but with these ones we know at least that they have been analyzed and studied and validated properly. My final slide is about planetary health. Because I told you many good things about nature and how we need to use it to be healthier ourselves. But for me, the most important is that we collectively understand that all of these benefits are gone, basically, if we don't take care of nature, of our planet, just as much as we try to take care of ourselves. There is an inherent link between the health of ecosystems, the health of ourselves. This notion is kind of lost, I think, in how we deal with society, urban cities, planning, etc. It is critical. We have come to a point in time where the planetary boundaries are 7 out of the 9 planetary boundaries are exceeded. We need to really collectively integrate this knowledge to gain and obtain all these benefits that I've talked about these few minutes with you. Thank you very much for your attention.